Hello everyone. My name is Kevin Song, and I'm gonna start the record my upload my some the problem solving the skills. I hope everyone sees my screen. Okay, so I'm gonna this is going to be the series for step two, the preparations, and then I'll focus on the questions that Cuban questions that is focused on step two, and then I like to like upload like very short the version of the instead of like teaching whole topics like very in detail. I like focus on more on the questions, and then the here we go. Okay, so I'll just do one question at a time. All right. So this is the test run. Okay, so I hope everyone sees my this screen. Okay, so please read the questions and then stop the video, and then we'll go from there, right? And then the pause the video and then the restart. Okay, so let me just highlight the word that is needed. It is keyword for this particular question. Okay, 68-year-old man and palpitations accompanied by mild dizziness or sweating. Abruptly, the symptoms started abruptly 30 minutes ago. Yes, abruptly. Okay, so what does that mean? Abruptly. So something you have to worry about emboli, right? Okay. He has had no the chest pain, motionless breath, and then the significant hypertension and myocardial infarction 6 months ago. The patient is an ex-smoker with a thoracic history. Blood pressure is this, and pulse is very high. And then oxygen saturation 98, and on desert cannula, and the prominent high amplitude jugular venous pulsation seen intermittently at irregular intervals. And ECG reveals a regular, wide, complex tachycardia. What do you think this the diagnosis? Regular, wide, complex the tachycardia. So you can rule out is aortic, like maybe the most common thing probably people think about like the atrial fibrillation. Does it fit with the regular? No, you can rule out these things, right? And then the high amplitude jugular venous pulsation. Do you see high amplitude the jugular venous pulsations in the pleural effusion, pericardial effusion? Okay, pericardial effusion is basically this is heart, and then you have the pericardium right there, right? So, oh, sorry, pericardium is right there. So pericarditis, that inflammation, it can be either coming from the pericardium itself, and then it inflamed, or this is like in uremic pericarditis case, or it can come from inside. So cardiomyocytes, so it inflamed, and then it just inflames goes to the pericardium. Okay, in both ways. But if the uremia, this is like a little deviation of this the pericarditis. Okay, is this topic, but uremia causing pericarditis will start from the pericardium. So uremia is the vessels that supplies blood vessels that supplies the pericardium. Is because of the uremia deposit here, uric acid deposit here, that will cause hardened the pericardium, and that causes the pericarditis. Okay, calcified the uremia. I mean the uric acid deposit here. So this will not affect the no cardiomyocyte involved. So what's the like pericarditis usually present? Like diffuse like the ST elevation, right? That's the like one of the key features, right? Also PR depression. So do you think this one will be shown in the uremic pericarditis? No, because it inflamed, pericardium inflamed, starting from pericardium. So this will not, distinct features you will not see in the like pericarditis in the caused by uremia. Okay, and okay, this is like a little slightly the off topic. Now, pericardial effusion means that if this is if there's an inflamed, there could be some secretion, and then it's like inflammatory material comes in, and so they will be inflamed here. So pericardial effusion is basically the same as like a minor form of the like a tamponade. Basically, the same thing. Okay. So in that case, do you see high amplitude or no low amplitude? Actually, you will see the one high, one the low, because what happens is alternating. It's called alternating electric alterance. So what happens is uh, you just the heart will pump, and then the pump, then it decrease this area, pericardium, like space pressure, right? Because it's hard contract, then it will just widen the pericardium space. So it will be you will see the less uh, contracting doesn't have any problem with the EKG. Now then, when you expand, it will just, your expansion will be blocked by this pericardium, right? Hardened pericardium. No matter what causes the pericarditis, it will just block the pericardium. I mean the heart to increase. So that's why it will just have like the first time is okay, second time is going to block. So third time it blocks again, and I mean third time is like okay, the contract okay, expansion block, extension the okay block. So that's why it just you will see like this. Okay, so that's what calls electric alternance. That's the kind of the key feature of the pericardial effusion, but you don't see high amplitude. Okay, and the aortic regurgitation. Do you see? Let me see. Do you see in the like there it says that the blood pressure is this, and the venous the pulsation, and then do you see intermittent regular intervals? Intermittently at irregular intervals? No, there's aortic regurgitation have regular intervals. You will see this kind of things regularly, not irregular. There's no no problem with the conduction or the heart rate. So it's not the case. So the problem here, ECG is a regular. But so do you know the third degree the AB block? What's the key feature of the third degree AB block? RRPP. That's what I mean. Yeah, QQ. Sorry, RRQQ. That's what I kind of remember. So what happens is sorry, PP. Yeah. So what happens is QRS, then QRS. This RR interval is same. Whereas the PP. So here, 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 this distance is same, but those are not related. So this RR, and then this PP, I mean, sorry, yeah, PP interval, those are like PP are same, PP here, PP here, PP here, same, but RR here, RR here, RR here, same, length, same. So interregularly spaced, but those are not related. So that's what the third degree AB block. So basically complete dissociation between atrial and then the ventricle. So that's what the AB dissociation. In that case, because it is that's what you will see the like a regular widely complex tachycardia. Okay, regular. because this is regular, regular, regular. Okay. So the answer is here. Okay, so let me just go to the answer and then see if there's any let's see, yeah, here answer. Okay, so you will see in this case you will see the Canon A waves. So what does Canon A wave mean? So um normal Canon A waves in the jugular venous, the venous pulsation. So it's that's the you measured in the what's happening in the tragus valve, the like you measured in the right the atrium. So that's where the pressure measured in here. Okay. So what happens is in the because in the JBD is measured here, it's same thing. It's a pressure in the cost the occurred from the right atrium. Okay, so what happens is that on the A wave is when tricuspid valve is contract, right? Then it's closed. Then the right atrium will contract, right? Right atrium contract is the A wave. So right atrium contract is A wave is the A wave. Just a minute. Let me just go down a little bit. Okay, so this is A wave here. So Canon A wave. So A wave here. So when the tricuspid valve is closed, then because it's the right atrium contract, then that will exert the so right atrium contract. This is a tricuspid valve, and then it will contract. Then it will shoot back to the jugular venous vein, right? So you will see the this A wave there. And then C wave is the when the right uh, at the when this is open, this is happening. When this is open, sorry about that. When this is open, uh, when this is open, tricuspid valve is open. This is we will see there's like a little bit of the A wave there. Now then, when the tricuspid valve closed, you see big waves. That's a C wave because you will the track will be closed against the track be closed. You will see the contract right atrium contract that will shoot back to the JBD, right? So you will have a big waves. That's what the C wave is, and then B wave is when the track is opening, then it will shoot down all the like blood to the right ventricle. So you will have like a go down, right? That's the B wave. It's sometimes the building, B filling, okay? So that's what happens. But in here, Canon A wave means that when there's like intermittent prominent A waves, so what happens when the when the atria and normally atria and the ventricle are supposed to communicate, but if there's like no communication here, it's that independent, then the atria and ventricle they stay contract at the same time. So then if this was contracting, this will shoot up, and then this is contracting, it will also shoot up. So both will contract at the same time. The JBD will become super high, right? So that's what the Canon A waves occurring. Both of them shoot up at the same time. Okay, so like if there's like the ventricular tachycardia, also like the AB dissociation, like a third degree heart block, AB block. Yeah, in these cases, it's also sometimes they call complete AB block. Okay, third degree is a complete block. Okay, and then you will see the Canon waves. Okay, so that's what the answer is. Okay, so this question is a little lengthy, so I explained a little lengthy, but this is just a test run. So from next time I will I'll make it like a kind of short, so you can easily digest. All right. Okay, so let me see. I'll just close this presentation and stop. Just a minute. Cancel. Just a minute. How can I cancel this? All right. Stop presenting, and then stop presenting, and then I will stop recording. Okay. Stop recording. All right. So stop recording and transcript. Yes. And let me see.